I'm Marianne Udow-Phillips. I am the founding director of the Center for Health and Research Transformation here at the University of Michigan, and I want to spend a minute with you talking a little bit about public health. Public health has long been underfunded in this country. Less than 3% of our total spending goes for public health. Public health has long been misunderstood in our country. It's easy to rally around a disease that affects you or your family. It's hard to rally around something that doesn't happen. And when public health works right, when it's really focused on prevention, bad things don't happen. Public health has long been focused on social determinants of health. And yet we live in a time of increasing income inequality, dramatically increasing income inequality. We live in a time when the deaths of George Floyd, Breonna Taylor, Ahmaud Arbery have made clear the amount of racism in our country. And yet, through all of this, COVID-19 has made clear how incredibly important public health is. And people know what public health is. This is the first time that I can remember being in a meeting with business leaders when they actually use the term epidemiology. It's the first time when my friends and my family have actually talked about contact tracing and testing. It's the first time when public health leaders have been in demand by the media to show up on their shows, or when for so many days in a row they've stood by their governors or other political leaders to talk about what's happening in this country. Trust in public health is high in this moment. It's high even as people show up at public health leaders' homes, some with guns, often with angry words, because they don't like the messages of public health. They don't like the measures that are needed to truly mitigate the spread of COVID-19. It's high even as public health leaders across the country have been fired for telling the truth, for sharing the data about what's actually happening with this disease. It's high even in our crazy, fragmented federalist system when our federal leaders, our political leaders say different things from our public health leaders, when the federal government and states are saying different things, and when our local public health leaders are trying to have a voice. It's high even in this moment when public health leaders are quitting at a rate that I've never seen before because they are afraid for the safety of themselves and their family. Through all of that, trust in public health is still high. And so the question is, can we build on that trust? Can we take this moment, this experience that we've had where COVID-19 has revealed both the importance of public health and the challenges public health faces? Can we build on really addressing the inequities that we have seen in health and healthcare, on social determinants of health? Can we change the way we think about public health, the way we finance public health, the way we structure public health? Can we really deliver on the promise of public health to address social determinants of health? Those are the things that I've been thinking about over these past several months. It's an opportunity we have. It's a challenge that we have. Can we take that moment? Can we build on trust in public health and really address the inequities that we have? That's what we're going to talk about in our session. I hope you'll join me. I hope you'll bring your creativity and your opportunities to think differently. Join me.